Hello, everyone. We have started Project Anubhav at Praan Wellness, where we take undergraduate and postgraduate students and provide them with experience regarding principles of psychology. Our first batch of interns are from Christ University, Delhi NCR. Last month, they had their community outreach program, and among all the tribes that we have chosen the best tribe that is here with us today. The interns will introduce themselves.
Hi everyone, this is Ahona. I'm currently pursuing a master's in clinical psychology from Christ University, Delhi NCR. I'm also an intern at Praan Wellness. We're working on a project called Project Anubhav.
Hi everyone, I'm Anisha. I'm also pursuing my clinical psychology from Christ University. I'm currently interning with Praan Wellness on their project Anubhav.
Hello everyone, my name is Diti Tiwari and I'm an intern at Project Anubhav at Praan Wellness, and I'm pursuing clinical psychology from Christ University. It's been a great experience to be here, the exposure and the level of skills and mentoring they provided us. I'm really happy. Thank you for having me here.
Hi, I am Rohit and I'm also pursuing my master's in clinical psychology from Christ University, Delhi NCR. And I am an intern at Project Anubhav at Praan Wellness. And I would like to extend my gratitude to the team for having us for today.
Thank you so much, interns. All right, I look forward to an interactive session with all of you. So, Diti, you are the team leader of the tribe, and last month you had an outreach. Would you like to, share your experience with us?
Yeah. Sure, of course. Well, we organized an outreach program on the topic menstrual awareness and hygiene, and we organized it at a church in Shahid Bagh. The students were from 8th to 10th grade, and it was a great experience. So, as we all know, that menstrual hygiene and even just the topic of menstruation, it's a very taboo topic. People just shy away from discussing about it, and there's a lot of shame involved in it. And we wanted to break that taboo, and we wanted to make the kids realize that no, it's a natural process. It helps you, and you need to be aware of it. And we included both the genders, the boys and the girls, because we thought that it's the responsibility of guys as well to know what is going on with their fellow human beings, right? And we discussed about nutrition. We discussed about the physiology that is involved, and the changes that take place. And then we discussed about the various menstrual hygiene practices and the products that are involved. And then we tried to like just normalize talking about all these terms and being like, yeah, it's perfectly fine, and be open about it and take pride in your anatomy. And yeah, I mean, it was a great initiative, and we were very surprised. The students, they were so interactive and they were so interested. So we realized that no, yeah, like it's a good initiative, and people, they are ready for the change, and it was amazing.
Yeah, actually, this is a very taboo topic, I think, when it comes to, India or anywhere else, I guess. So it's like it was very important to let people know about it and aware them about all the changes. And it is an important topic to take. And it was actually very challenging, because there's so much taboo that some may understand, some may not understand. It's like it's difficult to make people understand about it, what is going on, what is not going on, and everything. And involving everyone into this, that as well is, a challenge or a task. It's like how do we involve them and make it interactive and not, yeah, because it has it's like, it can always backlash. It can always turn into something negative, and people can always be like, what is this? Why are you talking about it? So yeah, it's a great topic actually. Thank you for sharing your experience with me. So, Rohit, would you like to say that why do we need to give so much importance to mental health, according to you?
Well, I believe that mental health is not something which is, you know, this is something which is equally important as physical health, but most of the times it is not considered to be so. It is something which people rather tend to either compromise with, or something which people often fail to even address to. For most of the times the concerns are unheard of, and even at a very personal level, people are not able to realize what exactly is happening to them, because in the whole hustle culture that we are into right now, it is difficult to process whatever we feel or whatever we emote at a particular point of time. So I believe, as much as we focus on physical health, I believe mental health is something which is, it's very important to address those concerns at the same time, because unless and until we don't reach up to that point where we start addressing what we are feeling at a very personal level, I believe even to keep up with the physical health would be difficult. It goes hand in hand. Like, you cannot talk about one of these in solitude. It has to go hand in hand. So I believe the whole point, be it reaching up to a community or talking to someone one to one about mental health, or in general discussing their concerns, talking about it, normalizing it, I believe this is as normal and very vital as for us as an individual to basically communicate that point, that it is something which is for true, because at times even the credentiality is something which is questioned. So
Yeah.
this is something that I very strongly believe.
Yeah, actually, it is very important, to let people know about it. It's very important to for ourselves as well, to have an idea about our own emotions and feelings at one point. Sometimes it's so much hassle and so much chaos that we tend to neglect our own mental health, or neglect things that we are supposed to actually sit and inspect and understand that actually what's happening with us. That's important. Um, Ahona, so like, what do you think? Like, has COVID changed people's view on, mental health? And if you think that, it has, can you explain how? I think Ahona has network issues. Okay, let's move on to Anisha. Would you like to take up the question?
Yeah, could you please
So,
repeat
yeah,
it?
sure. So, according to you, like, has COVID changed people's view of mental health? And like, if you think so, can you
I
explain
think
how?
I think I think like before COVID hit the world, people still had a very stigmatized view of the entire discussion that came after you uttered the words mental health. Like Rohit said, we never really considered that there is a mental aspect to our well-being. It's just that, eat, sleep, and then everything is fine. But after COVID and during COVID, in fact, I think that we have fostered a lot of discussion on mental well-being, because it was the first time that people found themselves unable to deal with something that they had, like they heard about it. Like, we always hear about someone suffering from depression, suffering from anxiety, but it was the first time that I think all of us collectively felt a sense of hopelessness, helplessness, and we were stuck away from our families, unable to talk to each other, and like we were all sort of like, in a state of panic. So I think that during COVID and post COVID, mental health will be something that will be more discussed openly, in fact, and encouraged in a lot of forums as compared to like pre COVID.
Yeah, I think even understood that it's very important because they understood they can't stay inside the house, and that
Yeah,
whole processing, and then not being able to go out, and then having not being able to work. There was no work initially, even the work from home was not actually immediately, it didn't start immediately. So even that, not being able to work, not being able to have interaction with anyone, not being able to go out, so all of that, I
yeah,
think it got a lot into the people, and they were
yeah.
like, "We can't do this. We can't do
For
this."
the first time, I think a lot of like the collectively everyone around the world experienced stress, instead of just being like go and do something like nice. They were all like, we can't do anything nice because this is a bad time for all of us.
And it was
So yeah,
collective. It was not like one person saying it,
yeah,
but it was like
yeah. It was
everybody
like,
going through it.
yeah, it was everyone, like not just like a particular midlife. We can't even say that our parents were going through a midlife crisis, because we were going through the crisis ourselves. So this was the first time that something like this happened.
Yeah, so it makes, people more believable. It's like, हाँ मेरे साथ भी हो रहा है. Like, it's happening with me also. It's happening with you also. So it becomes like, yeah, there is something maybe. Yeah, I think that's why,
And to this, even I would like to add,
sure.
even to this, like even I would like to add something. Like just like we are talking that this was for the first time when people could actually realize what it is all about. The kind of denial that we people have been dealing with, that okay, there is nothing, so if we are overwhelmed, we can get
I think we lost you in between. Can you start again? Like, can you say again?
okay. Am I audible now?
Yeah, yeah.
Can I get a check?
Yeah, you're audible, Rohit.
First time that it happened, that we came to this realization that something like mental health really exists. I believe on a very personal level also, the kind of denial that we used to get around from people, that nahi, aisa, there's nothing like that. Okay, if you feel that uneasy about yourself, go have something good, maybe take adequate sleep and it will be done. Because there was a complete dismissal. People are not ready to accept it as a fact. But during this time, I believe a lot of people actually started accepting. Like, I believe even that would have been a big step for them, uh, because of the kind of attitude they had towards mental health. And on a very personal level, like I have met people who had a very different attitude about mental health earlier. Like, okay, there is nothing like this, or maybe this is a very elite practice when you talk about
Hmm.
mental health or something. You need to have your own bubble of privilege when you talk about this. But people actually realize that this has nothing to do with the privilege, or this has nothing to do with the status or anything. It can happen to anyone and everyone. And this was something which was a groundbreaking reality check that people needed to have, and this happened.
Yeah. So it was like the generation which was not actually accepting of it was our parents' generation or our grandparents' generation. So when it's like what the more similar you see things are, the more you start to accept it. They saw the similarity everywhere. It was not just one person who was saying it. It was almost everyone who was, saying the same thing. So it becomes it makes you feel like हाँ ठीक है ये सच है. Like everyone is actually saying it. People are not making it up. Not so many people can make it up. So I think that is how it's like yeah, this is actually a real cause or real something that is happening. I think that actually had a good effect on people and they started accepting and recognizing the issue. I think that's the thing. Thank you for sharing your views. Avona, when you were out, we had the discussion about the mental
Hi.
health. Hi. So I'd like to ask you, like, if I would ask you if there would be three things, what would you do? What three things would you do along with your, team members and to change the view and the perspective of mental health in India?
All right. So I don't have like three specific things here to talk about that I'd like to do with my team. But what I'd like to speak about today is, there is this notion currently that yes, people are talking about mental health. People are reaching out, and they're talking about how to change the perspective and the perception about mental health. From reaching out to people in the outskirts and villages, taking out the stereotypes and superstition from mental health, and even in the corporate world, in the city area, all the corporates have. Hi, am I audible?
Yeah, you are audible.
So even in the corporates, they have set up many essential programs for their employees based on mental health. But what I'm and this entire thing is a very good progress from where we were initially, right? But what I want to focus on today and work on with my team members is on the industry itself. I want to talk about how mental health professionals and people associated with them who are providing support to people who need help can deal with the situation in a better manner. because there have been some instances and some issues which work towards potentially reversing the entire effort that has been put forward from the other side or from the people's side, right? For example, there are many mental health clinics and institutions forming around us right now. They have
Mm.
incorporated and appointed many highly experienced and mature therapists in their clinics. However, they put very little attention towards who they are appointing to take the first call, to take the appointment for the clients. They have very little or no knowledge about psychology or the entire topic about the stigma of mental health, right? So I would like to talk about a personal experience here. So recently I called up a clinic because as a part of our curriculum, we are supposed to take therapy. So I called up, and the person who received the call was very stern, and she only wanted to know who I want to take appointment with, and there was no warmth, no welcome. So I'm not asking for help, but as a person, as a perspective, if you look at from a person who wants help and is reaching out for support, that kind of an interaction really shocks them. It's really detrimental for them, because making that first call itself is a huge barrier breaking thing for them. So I think this is one thing that people can work on, and I would like to make people aware of this. Secondly, she also, what she did was, she was like, send me the patient's name. So these terms like patients, help, disorder, disease are very, it's like, it makes you feel like, oh, am I sick? Because after that using of those terms, I wouldn't want to call her back again. So, and the entire effort of actually making the first call, it just goes to waste, right? So,
Yeah.
we must replace these terms, and also the entire tone and language of the first
Mm.
person taking the call should be changed, I feel. There's one more thing I want to talk about here, is that although there has been an improvement from removing the stigma of mental health, and people are starting to talk about it, but I feel like it has again been limited to clinical conditions. I mean, there has to be some kind of a severe or serious thing wrong with you to actually go for therapy. Therapy and going out reaching for help has only stuck between depression, OCD, and PTSD, or some, like these severe
Yeah.
disorders, severe
Yeah.
conditions,
The diagnosed
right?
disorder.
So
Yeah.
I think these, yeah. So again, from a personal experience, I was talking to some therapist, not taking therapy, but generally I was having a conversation, and I told her that I'm looking forward to getting therapy. I did not tell her about the curriculum thing, but I just told her, and
Mm.
her first reaction was, "Oh, therapy? Why therapy? Is it that serious? Why are you taking therapy?" So that really came as a shock to me, and I was like, and she's a professional clinical psychologist practicing. So I mean, obviously, not all therapists or not all professionals are like this, but there are some people like this, and we must change this. So I think this is what I'd like to work towards with my team.
Yeah.
Thank
I
you.
think that's a wonderful thought actually. I mean, it actually makes sense also because it is very important to, when someone comes for therapy, already they are fighting taboos and already they are fighting everything, while they are there. It actually takes courage to, approach or even approach for the therapy or just go for the first session. It actually takes a lot of courage. And then when you hear someone say something like this or be so cold or rude, you're like, I- should I go? It's okay, I won't go, I'll deal with it. It becomes like that, yeah. I think that I have actually never thought about it. That's actually very nice. It's very important to have someone who's very warm and understanding and not so, rude or cold towards whoever comes for the therapy. Because the reason might be anything. Even the second thing that you have said that the it's only okay or it's only acceptable. I think to the point if you go for a therapy, if you are diagnosed with something really big or if you are diagnosed with something. So I think that also needs to change. People need to understand that therapy could be for anything, not just after you have been diagnosed, but it could be for like stress or just depression or just being sad, not being able to, go through the day. It could be anything. It it need not be. specific, or it might not be diagnosed before people start taking your therapy sessions seriously. That is also very important. And the third thing that you said, that was sorry. The third thing you said was about. Can you just repeat once again?
Changing the terms we use,
Yes.
patient disorder. So I mean, you don't need to have a disorder, right? In the first session you can have
Yeah.
you can just go out
You
there,
could
right?
just visit
So
for,
referring to
yeah, you
someone
could
as
just,
patient.
yeah, you could just
Exactly.
visit for like a stress issue, or you're being just anxious for something that's coming up. It would be anything. I think, yeah, these things actually act like a barrier to all the things, to actually approaching or going for the therapy. These act as a major barrier somewhere or the other. It makes people resistant to approach or to even, take their step forward. So I think, yeah, these things need to change. Thank you for sharing your views, Rana.
Yes.
Uh,
Thanks.
Diti, like, what are the few tips that you would like to share? We have audience over here, and what would you share with our audience who are currently in college and, stressed due to everything that's been going on? It's COVID, it's your online classes, offline classes, traveling. So, like, how do we, deal with those so much stressors and stress?
Yeah, I think that the change and the whole pandemic, it has affected our life in a very severe way. Also, even if we don't talk about pandemic, these stressors existed before as well, but it's just that now we are more openly addressing them, which is like a very good thing. I think that one of the first thing is that as a student, you are just in hopes to, get good marks and then land a good job. And then there's this rat race that goes on, like you have to be on the top. So one of the first things is that stop perceiving yourself in just someone who has to score good. Marks matter. I'm not saying marks don't matter, obviously, but they're not your definition. You will get a job on the basis of your skills. If someone is scoring good, but they don't have the skills, they don't have that experience, they don't have that attitude, they don't have that skill set, marks don't matter. You might not be able to continue your job for a very long time, right? So I think don't just limit yourself to marks. Secondly, just I think nowadays people just don't even give themselves time to think. They think that when we go to college or when we go to school, we just grasp a lot of opportunities. I think we should take it a little slow. When you just enter an environment, one of the tips is just just first settle down, perceive, look what you can do, because then you might run into a burnout which will not really affect anyone. So start slow and do things in a limited manner, but things that you can give you 100% to. It's not that okay, now I've joined this community, now I've joined this NGO, now I'm also doing this internship here over here, then I'm writing the research paper, because then you're not able to commit to them 100%. So know your limits, and yeah, I mean, give your 100% in them. Time is not going anywhere. Secondly, I also think that because online, so a lot of colleges and schools, they're still doing the online more. So I think that first of all, the thing is that you sit in an online class and then you're just busy on your phone. I know that it's hard to listen to a voice recording and it's just classes going on for like 5 hours or so, but you need to avoid your distractions. You actually need to treat it as a class is going on. You see, the thing is, when you're sitting at home, you're able to prepare yourself better. So make use of that fact also, and exercise and eat well. It's very important. You know what, every time we say this, it's just something that we've been hearing ever since we were kids, but there's a huge backing up to it. Like exercise is not just about, oh my god, me going to gym. It's just, even like, I like to dance and I dance a lot. So that for me, it exercise. I get to body train myself. I get to just stretch myself and just eat well. Also, stick to a hobby. Like, it's not just, you're not just someone who is here to study, right? You have hobbies, you have your passions, stick to them. Like, give yourself that time. You deserve it. It's not just about studying. Life is not just about getting a good job. Like, a good job might not even satisfy you. So yeah, I think that is a very important part. And self-care is, I think, it's immensely important. And nowadays, people just they just disregard themselves, and I think that that's not a good thing. if you think that you deserve a good job, then don't you think that you also deserve good care, good just good rest, and just being happy? Because if you see that the life satisfaction is more in people who are at a medium, who are like middle class families. Why is that so? Because the amount of stress they take is less. Okay, they might also be more family oriented. What I'm trying to say is ki, get yourself connected, get yourself connected to your inner self. Give yourself time, take time out for yourself to just pamper yourself, just go out on a walk, just watch a movie, sometimes just take a vacation. And don't be so hard on yourselves. We're just too hard on ourselves. It's just we set this bar for ourselves, and for the others it's this, and for ourselves it's this. So why is that so? We don't deserve the love, we don't deserve that care. So I think that, yeah, these are a few tips. And also I think if you face some problems, because this is a mental health awareness thing, that Pran is all about mental health and mental wellness. So talk about your issues. If you need help, you ask for it. There are, like, even Pran, it provides free counseling, right? It provides, so many NGOs have opened up. So do seek out for help, and do look out for these symptoms. Don't ignore them, don't ignore yourself. Don't think that arena this will go away, because it will not. And it might cause actually a serious problem in the future, and I don't think we want that. So I think these are a few tips that I think would work if you follow them.
Yeah, yeah, actually, they are really nice. The thing about self-care, actually, it is very important. It's like taking time for yourself, no matter how busy your day has been, or your week has been, for that matter, or your month has been. That's okay. I mean, anything, but just take out some time for yourself and give yourself time, understand yourself. It is very important to do that, because if you get into all these studying or job work, and just do everything that people are asking you to do, or just do everything like studying all the time, or everything doing not doing anything for yourself, that would hinder, or create a problem or something like that. It's very important to take care of your own self, and it's very important to have one thing to stick to, or one thing to go to when you feel stressed. This is what, like, when I personally think, that when things are really rough, or when it's too much frustration, too much things that are happening, या फिर पढ़ाई, it's a lot of studies, or it's a lot of work or something, just take some hobby, or make one thing as your ground, and just go to there where you can feel your calm, and you can calm down, like, where you can be peaceful, where your actually mind refreshes. And then just take time for yourself, and then come back to work. It's not like just be there, but that would help to energize, re-energize everything, and help you actually feel motivated and avoid burnouts, for that matter. So I think, yeah, self-care is very important. And even at Pran, we do provide counseling, and you like anyone can book it through the Pran app and everything, Pran website. Yeah. It was really an amazing session with all of you. It was such an interactive and so many new things to learn. I mean, everyone's answer was something new, and something like one point from every answer. It was really nice. And thank you, all of you, for joining. And thank you so much to all the interns for joining me today. And on behalf of Pran, I extend heartfelt gratitude to the interns and the Christ University, Delhi NCR. And it was a really amazing experience to have you all as interns. Thank you so much, guys, for joining.
Thank you.
Bye
Thank
bye.
you.
Thank you.
Thank
Thank you so much.
Bye.
Bye.